First, I'd like to introduce Dr. Arlene Morales. We're very excited to have Arlene here today, but she is a local reproductive endocrinologist. She serves patients here in San Diego, and she is somebody that we are very pleased to have here today. And Dr. Morales is going to share with you about her practice here in San Diego and her experience with patients.
Good morning or afternoon. My name is Dr. Arlene Morales, and I've been in San Diego practicing reproductive endocrinology since 2000. Every day we see patients and couples suffering from infertility, and we see all kinds of patients that are coming in the door. Some patients, independent of the socioeconomic status, are surprised to know that they have what they thought was good insurance until they realize they may have no coverage. So typically we have several patients who sometimes have what they think is good coverage, and then they don't have anything further than diagnostic coverage. So they can have some coverage of understanding why they're having trouble conceiving, but not really help in any of the therapies that can help them conceive. Other couples have diagnostic coverage and some treatment coverage. Unfortunately, sometimes the treatment coverage is not the appropriate treatment for those couples. And they may have coverage for what we call low technologies, not necessarily in vitro fertilization, which may be their only option of conceiving. Alternatively, we have some patients in this area who also have no insurance coverage whatsoever, and sometimes they're looking at short-term solutions as opposed to, again, treatments that's in their best interest. Every day, my partner, Dr. Wendy Shelley, and I counsel these patients as well about access to care and what they can do. Thankfully, we live in San Diego where there are lots of small companies, and one of our mottos is one company at a time. Usually when we see that one patient who will go back to their HR if they feel comfortable discussing why they're seeking care, maybe the straw that broke the camel's back, and the company will decide to change policies and have coverage for the entire company. Sometimes it's when we see someone on their executive team that they realize they do have access to different kinds of plans, and the entire company will now have coverage. So I think we've been through a few companies through San Diego where we are lucky to have a lot of small business growth and a lot of small employers who are able sometimes to change coverages for patients. But it is something that daily we struggle with, in addition to their medical concerns and the stress of undergoing infertility care and therapy. It's yet one more stress upon a couple. Thank you.